So have you been following the news around H5N1,
Mm.
bird flu? Because something pretty important just happened regarding how health agencies are handling it. It's a shift you'll definitely want to understand.
Yeah, significant change in approach.
Exactly. So today, we're doing a deep dive into the CDC's decision, the recent one, to end its emergency response for H5N1 bird flu here in the U.S. We're going to unpack why they made this call, what it really means for public health, and, practically speaking, where you can actually find the latest info now. We've looked through the reports and the statements, the sources you shared, and, well, our goal is to give you that shortcut, the key takeaways.
And it's important, I think, to understand why these strategies shift. It's not just paperwork. It signals a change in how we manage potential threats long term, moving maybe from pure crisis mode to something more integrated.
Right, integrated vigilance.
Yeah.
I like that. Okay, let's get into it then. The big news was July 2nd, 2025, CDC officially closes its H5N1 emergency response. That sounds pretty major. What were the actual reasons the CDC gave for ending an emergency status like that?
Well, they were pretty clear about it. Two main drivers, really. First, they have seen a definite sustained drop in animal infections, fewer cases popping up in livestock and wildlife. And second, and this is, really key for the public health side, no new human cases detected in the U.S. since way back in February 2025.
Since February. Okay.
Yeah, so those two factors together suggested the immediate threat level had, well, changed enough for them to pivot strategy.
And what does that pivot look like in practice, surveillance-wise?
It means that monitoring for H5N1 bird flu, it's now going to be folded into the regular seasonal influenza program, which is a pretty robust system already. It leverages that existing nationwide network we have for tracking flu and other respiratory stuff, makes it more sustainable.
Sustainable, yeah, makes sense. Less like a separate emergency operation.
Yeah.
But here's something really practical I noticed, a big shift for anyone trying to follow this closely. Information on the animal infections. It's not going to be on the CDC site anymore.
That's right.
Instead, you have to go to the USDA website for that data. That's quite specific. What's behind that move?
It really points to a better division of labor, maybe, based on expertise. The USDA is the lead on animal health, right? So putting the animal infection data there centralizes it for vets, farmers, agricultural folks.
Okay.
While the CDC keeps its main focus on the human health surveillance side, it suggests better coordination between agencies, which is vital for these zoonotic diseases that jump species.
Yeah, that coordination seems crucial. Okay, so putting this decision in context, what did the H5N1 picture actually look like in the U.S. before they made this change? What were the numbers?
Yeah, good question. Looking back, the total count for human cases in the U.S. reached 70 confirmed cases.
70.
And sadly, there was one death linked to H5N1, specifically reported out of Louisiana. On the animal side, the infections were mostly concentrated out west. Think California, Washington, affecting dairy cows, some goats, poultry flocks too.
Okay, cows, goats, chickens, mainly West Coast.
Exactly. But here's the really critical point for public health assessment. To date, there has been absolutely no evidence found of sustained human-to-human transmission.
Ah, okay. That's the big one, isn't it?
That's the key factor. That kind of transmission is usually what triggers the really severe public health emergency declarations and responses.
So because of all that, the drop in animal cases, no new human cases since February, and crucially, no human-to-human spread. The CDC is saying the current public health risk is minimal. That sounds reassuring.
It is, based on the current data. The assessment uses epidemiology, case numbers, spread patterns, how well containment is working.
But some people might still hear H5N1 circulating and feel a bit uneasy, even if the official risk is low. How do agencies balance that?
It's always a communications challenge, right? The minimal level reflects the science right now. But the key takeaway is ending the emergency response doesn't mean ending monitoring. Not at all. Active, continuous surveillance is absolutely still happening. This isn't saying the virus is gone. It's a change in the intensity of the immediate response, reflecting the current risk. And CDC and HHS teams are ready. They can ramp things right back up if concerning cases pop up again.
Okay, so the system can flex back if needed. That's important. So drilling down then, what does this shift really mean for for you listening, for the average person trying to stay informed?
Well, a few practical things. First, yeah, the drop in cases, both animal and human, is genuinely good news. It suggests less immediate, widespread concern.
Okay, that's a relief.
Second, as we just said, the public health work continues systematically, even without the emergency label. Monitoring is ongoing. Third, if you want to track the human H5N1 situation specifically, you'll now find updates in the CDC's monthly Flu View report.
Flu View. Okay.
Yeah, it's their big summary of all influenza activities. So H5N1 human status gets rolled into that regular reporting.
And the animal side.
And, like we mentioned, for animal infections, the primary source is now the USDA website.
Right. USDA for animals, CDC's Flu View for human status within the broader flea picture.
Exactly. It shows how, you need to know where to look for specific pieces of public health information. It's becoming more specialized.
But it wasn't all just everything's fine now, was it? We heard experts sounding a note of caution, too.
Yes, absolutely. It's really important context. We know that respiratory viruses, including flu strains, often pick up in the autumn and early winter.
Right, the usual flu season timing.
Precisely. So that underlines the need for ongoing vigilance. The virus hasn't disappeared. The approach to monitoring it has just evolved, becoming part of the standard, robust flu surveillance system, which is designed to detect changes and allow for scaling up the response if needed.
Okay, so let's just quickly recap this deep dive then. The official H5N1 emergency response ended July 2nd, 2025. Doesn't mean the threat is zero or monitoring has stopped. Active management is now part of regular flu surveillance.
That's the gist. The human risk is assessed as very low right now, based on the data. But yes, monitoring is definitely continuing, and crucially, you need to know the new places to find the specific information USDA for animals, CDC Flu View for human cases.
So as we wrap this up, it kind of leaves you thinking, doesn't it? In this landscape where health information keeps changing and even the sources for that info shift around, how do we make sure we're getting the whole story, the really nuanced picture, especially after an emergency is officially over? It really highlights that need for, well, informed vigilance, even when things seem quieter.